Hi folks, welcome to the Untold Stories of Civil Society Actors Unifying Communities Across the Globe. This project is part of the University of Toronto Scarborough's annual Global and International Health Week, with the theme this year being Pandemic Perspectives. In partnership with the Knowledge Equity Lab's OpenPraxisForum, students from the IDSC 11 Issues in Global and International Health class are presenting multimedia exhibits, each focusing on critically analyzing how particular players have addressed the COVID-19 pandemic. Today we have prepared a unique experience that will allow visitors to explore and interact with the virtual world that will provide participants with various resources, museum-style, to learn more about the work of civil society. The World Bank defines civil society as a wide array of organizations, including, but not limited to, local projects, NGOs, labor unions, and charitable or faith-based organizations. Others explain civil society simply as a community of citizens linked by common goals and collective activity in the public's interest. This term became popularized as neoliberal policies began to shrink public services and public protections during the 1980s. It has also been used in reference to non-state movements organized as a way to defy authoritarian regimes.
When civil society groups are mobilized, they can have the power to influence actions of policymakers and businesses, consequently playing a critical role in societal development. Civil society organizations do this in multiple ways, such as holding institutions accountable by promoting transparency, raising awareness on issues, providing health, food, and housing security needs, as well as quickly responding to disasters and emergencies. During the COVID-19 pandemic, these groups have played a vital advocacy and action role, which can be illustrated through their work lobbying for better policies and supplying relief items as well as services.
Their policy work strives to uplift often overlooked or forgotten voices by engaging in meaningful and sometimes confrontational discussions with those in power. The programs and services civil society organizations provide to different populations range from collaborating with local charities to deliver social services to pushing governments to cover the cost of treatment and vaccines for all citizens. Lastly, they play a crucial role in advocating for social protections, including better regulations of workplace conditions through labor laws that guarantee sick leave and ensure occupational health and safety. For example, civil society groups may fight for frontline workers' PPE needs.
As countries begin easing pandemic lockdown measures, civil society calls to have life not return to how things were before are getting louder. The pandemic experience has exposed long-standing systemic injustices and highlights the drastic racial, gender, social class, and other inequalities in the global neoliberal order. As a result, many civil society groups have taken on the role of watchdog. They look out for those whose justice has been ignored by actively scrutinizing governments and the actions of the private sector.
Each one of us focused on a particular aspect of civil society. We invite everyone to follow the arrows and visit each of the different areas created. We recommend spending about 8 to 10 minutes per room, but encourage you to use more time if you'd prefer. Upon entering, the room's leader will provide visitors with a brief introduction of the topic. If the room leader is not present, a pre-recorded version will be available to watch. Each room also has a designated private space for further discussion where you can ask questions that may arise upon viewing the information being shared. After following the entire route, you are also invited to chat with other participants in the conference table area. Whenever you're ready, feel free to start your tour.
How COVID-19 has impacted mental health and the ways in which civil society has been working to alleviate these issues. It is important to keep in mind that not everyone is fortunate enough to have been quarantining for the last year with family in a safe, healthy, and economically secure household. This group would likely face less stress due to such a sharp change in their environment compared to others lacking protection from workplace and transport exposure, impoverishment and loss of shelter, as well as gender-based violence. But even those with greater protections may have had to face greater burdens of care for children, elders, and other dependents. Additionally, several groups have faced heightened discrimination over the past year. In North America and parts of Europe, there was heightened mobilization regarding police violence against Black and Indigenous people. Individuals from Wuhan and China generally have been targeted and blamed for COVID-19, and there have been alarming waves of anti-Asian rhetoric, as well as an increase in hate crimes against Asians in the West. Those directly and indirectly affected may be experiencing greater struggles with their mental well-being. Another highly vulnerable population is youth and children who have been separated from their caregivers, as they are more susceptible to mental health problems. These various forms of separation can occur because of infection or being put under the care of social charity groups as a result of having their guardians get sick or pass away. The loss of a family member causes immense grief and fear, possibly pushing a child into a state of crisis. Family separation can also generate severe mental health distress. A study in China found that 30% of the children who were isolated or quarantined met the clinical criteria for PTSD. The remainder of this video is going to focus on 2 civil society organizations that prioritize youth empowerment in the face of the pandemic. Founded in 2011 in Puducherry, India, Trust of Youth and Child Leadership International, or TYCL, was formed to create safe and inclusive spaces for young people to realize their full potential. As of 2019, the chapter in India was being supported by over 100 local volunteers and successfully running 13 different projects and programs. An amazing initiative TYCL started back in August is a virtual creative arts camp designed to foster positive mental health for Black, Indigenous, and other young people of color within the United States. Like other youth, they have lost regular recreational, artistic, and extracurricular outlets typically provided at school. This may be compounded by systemic oppression and its effects on health. To address these issues, TYCL believes it is vital to provide young people with avenues to develop confidence in their identities. The arts offer a positive method of coping with mental stress and have historically been used as forms of empowerment, expression, and communication. Just recently, the streets of various American cities were painted with Black Lives Matter, and art pieces have been displayed honoring the lives of George Floyd, Breonna Taylor, and tragically many more who were murdered by police. One TYCL priority is to overcome the way art, with a capital A, referring to what is found in museums or performance halls, has historically and continues to tailor to middle and upper class communities. To combat this, youth in various states were invited to engage virtually in a week of creative activities such as painting, spoken word, and photography. The camp offered a space to explore and release the emotions arising from living through a global pandemic and linked to the fight for racial justice. Additionally, TYCL's planning team is both interdisciplinary and interracial, involving a social worker, an arts administrator, and various artists. TYCL collaborates to welcome different levels of expertise and multiple voices to the table. Now, I would like to move on to another wonderful group known as the Accountability Lab. This organization was founded in Nepal in 2012 as an effort to work with young people to develop new ideas for accountability, transparency, and open government. It has evolved into a global network of local labs that are finding new ways to shift societal norms, solve challenges, and build unlikely networks for change from a youth perspective. They dream of a world in which resources are used wisely, decisions benefit everyone fairly, and people lead secure lives. Accountability labs shift discourse around accountability from negative conversations to constructive actions, equipping reformers for collective action to push for better governance and promoting collaboration by supporting community feedback loops. The Liberian Accountability Lab and their Rap to Rep campaign is the first of its kind. This initiative invited young musicians to create hipco songs, a genre of hip-hop from Liberia that uses vernacular speech and incorporates political messages related to coronavirus. Their goal was to find a melodic way of carrying necessary health information to communities, such as encouraging social distancing, wearing masks, and regularly washing hands, since Liberia's COVID-19 infection rate has been growing. In fact, the music that has been playing in the background throughout this video is one of the songs that 15 Liberian hipco artists collaborated on in hopes of stopping the spread of the virus. We hope you enjoyed listening to it as much as we did. To see a list of all citations used throughout this video, please visit the bulletin board, which has been placed to the left of the projector screen.
Hi everyone, welcome to my area. I'll be looking into the marginalized groups who are significantly affected by COVID-19 and what civil society organizations played a strong role in aiding and supporting them during this time. I'll be looking into these issues globally and specifically on how each of these groups were affected individually, then researched and found 2 civil society organizations groups that have contributed in improving these individuals' quality of life. Let's look at the first poster first, which outlines all the groups affected during COVID. Elderly. Older adults likely already have underlying conditions, such as cardiovascular disease, diabetes, or respiratory illness. A challenge to prevent older people from being exposed to the virus because they may not be fully independent. Clinicians must recognize the importance of non-pharmacological approaches being more effective than pharmacotherapy for treatments such as chronic stress, anxiety, and prolonged grief. Such approaches include manualized therapy, such as CBT, cognitive behavior therapy, promoting physical activity, greater connectedness, and compassion training. These approaches are also shown to enhance coping, promote resilience, and reduce loneliness. This connects to resources as they lack material from access to smart technology, not being able to socialize, and a decrease in cognitive and biological abilities because of inability to engage in physical exercise or participate in activities or routines. However, civil society has played a crucial role in ensuring these routines are not disturbed and continued for elders. Next is people without permanent shelter. They may have less access to COVID-19 information than the general population, and their survival needs may prevent them from following basic public health guidelines such as wearing and washing/replacing masks, hand hygiene, and physical distancing. Those who lack permanent shelter often have underlying health conditions linked to a poor living condition and are often malnourished. The Canadian Civil Liberties Association reveals that a number of individuals set up encampments, then entered into shelter spaces as well. Most shelters are unable to ensure physical distancing, and through much of the pandemic, there have been shortages of masks and personal protective equipment for both staff and shelter users. Because homeless individuals are also transient and mobile, it is more difficult for public health personnel to track and test for COVID-19 and prevent transmission. Next is persons with disability. There's a harder to access to critical medical supplies as it is becoming more challenging when resources become scarce, higher levels of social isolation policies around rationing of medical care. This leads to discrimination. COVID-19 can worsen the secondary aspects of disability, such as those who already have suppressed immune systems or respiratory concerns. Canada has overlooked disabled individuals and their essential caregivers as priority group in its COVID-19 vaccine distribution plan. However, this is not a new problem, but it's just COVID revealing the ways in which they have been continuously leaving out those with disabilities in regards to accessible info, housing, education, financial support, and healthcare at all government levels. Emergency planning and response systems rarely give any focus to those with disabilities. Lastly is pharmacist workers, who we are constantly hearing about on the news. They are filled with far more responsibilities, creating a higher level of physical and emotional stress. This leads to a number of consequences: emotional exhaustion leading to medical errors, lack of empathy in treating patients, or mental drainage, lower productivity, and a higher turnover rate. During COVID-19, pharmacy staff have been having to deal with drug shortage and addressing drug hoarding, along with providing physical and mental support for staff and delivering the flu in time and COVID-19 screening/testing. Alongside to this, they have also been making sure they are collaborating with other healthcare facilities, healthcare professionals, and need for more staff training and more precise research to provide accurate information and ensure there is a more organizational and workplace support. They have also been exposed to higher infectional risks, moral dilemmas, excessive workloads. Pharmacists are also responsible in communicating with other HCP on behalf of their patients to ensure the accurate drug orders and provide recommendations to improve medication management, which is largely time-consuming. The entire experience can be traumatizing and heighten the risk of mental health conditions in a group that's already at an increased risk. As well as on the news, they are praised for sacrificing and providing life-saving services and are portrayed as heroes. This creates expectations of having to consistently show personal strength and resilience, both emotionally and professionally.
During the pandemic, grassroots collaboration has been extremely important to providing support to different communities across the world. Because of this, grassroots groups are being recognized for the crucial part they are playing in local responses to COVID-19 beyond the role of national CSOs and elite organizations. COVID-19 has led to a surge in grassroots collaborations with other civil society actors. Since many CSOs have been facing financial challenges during the pandemic, they have sought to deepen their ties to other CSOs and grassroots efforts in dealing with the crisis. In fact, travel and curfew restrictions have led to a number of national NGOs to rely more on local actors to run program activities and lead community work. Although such arrangements were not designed in advance, these changes may possibly open new horizons for grassroots organizations to wield more influence and play leadership roles in civil society engagement in the future. Across the globe, there are thousands of grassroots and CSO collaborations which are supporting communities affected by the COVID crisis. In this video, I will shed light on how coalitions have become a positive and important face in helping people in different places during the pandemic. In Gaza and the West Bank, there are numerous families suffering from the collapse of the economy and living without food and essential supplies. One organization called Rebuilding Alliance is raising money to provide assistance to these families. It has partnered with hospitals and grassroots groups to bring ICU equipment to hospitals in the area. Some of these partners include the Women's Program Center, Youth Vision, Al Basma Club for the Disabled, and Al Amal Society, which supports the overall well-being of the community. In Mexico, the International Community Foundation has connected with several grassroots groups to provide support in the violence-ridden region of Tijuana. The The ICF has provided mental health support, employment opportunities, and legal assistance to residents. These grassroots groups have also provided food, medical treatment, and shelter to those in immediate need. Together, they've raised over $45,000 for the community. In Europe, new collaborative networks have been created from the bottom up, focusing on community-level support. In England, over 4,000 COVID-19 mutual aid groups are connecting with each other. In Belgium, grassroots have organized ways to provide food for healthcare workers who have been working extended shifts. Meanwhile, volunteers in Germany have created a platform to organize people-to-people assistance for daily support. In Spain, a network of organizations have teamed up to distribute 3D ventilators and face masks. In Rio de Janeiro, civil society and social movement organizations including Occupy Alamo, the popular media activists, Voz das Comunidades, and housing rights organizations have created a citizens' council to address the pandemic. This network focuses on 3 activities: raising awareness to stop the spread of COVID-19, producing, collecting, and distributing essential items such as food and sanitary products, and reclaiming public programs targeted to the favelas. Ultimately, these various examples show how collaborative initiatives in different places are drawing from solidarity and mutual aid efforts while also making demands on policymakers. Grassroots networks have been a force that confront capitalists and state actors that are overlooking community decisions of the crisis. Civil society networks and their work will undoubtedly shape the way we come out of this pandemic.